Here from Croakey. We're at the end of the Navigating Health Croakey Go, sitting here with the CEO of Northwestern Melbourne Primary Health Network, Adjunct Associate Professor Chris Carter. It's been wonderful walking with you today and talking with you, and thank you very much for sponsoring the Croakey Go.
Okay. Fantastic. It was a really fantastic event. Fantastic, wonderful, large turnout, really engaging people and services right along the route. So thank you.
So, as the CEO of a PHN, what did you take away from the conversations? What are some of the standouts for you?
Some of the standouts are that we don't know what we don't know. And having that deep engagement with people and services on the ground really informs and awakens you. And for me in particular, there is a whole lot of detail that I didn't know about. So as a CEO, sometimes your head's in the clouds and you're wandering around and making grand pronouncements, but actually hearing the real stories, seeing people, feeling their passion, really, for me, was quite energising.
And is there anything that you'll do differently as a result of today?
I think, as I said in the opening remarks, it's easy to sit behind a desk and look at stats and patterns and programs and think, oh yes, that's the way we should do it. So for me personally, what I would do differently is to go out and have those conversations, to keep refreshing myself, to keep making sure that I connect with reality on the ground so that I can have an informed view about the way in which we plan and fund services.
So it's beyond reading the reports online or being in meetings, actually getting out, walking
into the real world and walking. I mean, it's been great walking.
Yeah, and that's what we love at Croakey about a Croakey Go, because we're all working in our offices, linking up online, but for us to get out and talk with people is really powerful for our work as well. I guess one of the issues that came up throughout a lot of the stops today was the importance of social for mental health and wellbeing, so in all different forms, whether we're talking social prescribing or addressing social isolation. And I understand your PHN is doing a bit of work around social isolation. Could you tell us about that?
Indeed. So we're in the process, very early days. We've commissioned some work out to Carers Victoria around social isolation and social connection. So really, the aim of it is to try and import some of the good models from other jurisdictions to try and apply them to an Australian and Victorian and Melbourne context. It's really clear from the consultations that we do and some of the design work we do, the co-design work that we do, that social isolation and isolation in general is a significant issue in terms of people's health and wellbeing. Compound that with issues around social determinants such as housing, income, that combination, that weight of issues creates significantly poor mental health and therefore poor physical health. So the social isolation piece we're doing as an aside to a social prescribing piece. So social isolation is itself about the individual and their connections. Social prescribing is about how does the service system respond holistically to that person's needs. So it'll be interesting to see how we track against that, or how the organisations that we funded track against that. And my hope is that we can actually develop a much more robust model of care that just doesn't focus on people's mental health or mental ill health, but actually focuses on them as a whole person.
And are we talking general practices or hospitals, or who can do this work?
So the social prescribing trial is between a community health service, a local government, and Victoria University. So it's really about bringing together the built environment, the open space, the social determinants perspective of council with that kind of social justice community health view from the community health side and VU are the evaluation partners.
When the PHNs get together, as I understand you do occasionally, is social isolation something that you talk about collectively? I mean, is it other parts of Australia also looking at social isolation as a health issue?
It's when we get together, we usually don't talk about that because we don't get together very often, and there's been a whole lot of time in recent time and places where we've been discussing policy issues more about the kind of the funding stream. So that's the boring bit in my life. But there are pockets across the country, other PHNs, who are starting to think about social isolation, social prescribing as potential frames for the work that they do. Because clearly that drives, as I said, mental health and physical health. So there's been some work done in Brisbane North. Brisbane North and ourselves are quite similar in terms of... 1 second, I'll price it up for you. In terms of populations, but also in terms of approach. We have a much more social justice, equity and access approach, and it reflects the populations. So there are patches, but it's quite immature at this stage. But I think that through these proof of concepts that we're doing, it will enable us to say, hey, isn't this great? Makes sense, and start to lead a different conversation.
And we started our walk today at the Victorian Aboriginal Health Service, which was really very special and powerful, being reminded of the history of Aboriginal community control sector, etc. But, listening to the VAR's speakers, it reminded me they've been doing this stuff.
Yep.
They're all about connection and community caring for community. So, what do the PHNs, I guess, take from that existing model?
For us, we find it a powerful and well-connected model. And as you say, they treat their patients, clients, citizens holistically. So from a PHN perspective, and certainly we've had the discussions internally, we don't want to pass on funded silo approaches to Aboriginal community-controlled organisations, because the level of duplication and paperwork and management that's required to manage the streams is just too high. So what we've tried to do is to work with them around bringing together bunches of funding streams, and when we work with them in contracting, we actually try to tie together those KPIs and those indicators that match better with the work that they do. So that's a very long and deep conversation, which we've been having for quite a while now. Long way to go, and it really is dependent on the way the government funds us and therefore how we fund them.
So you're trying to use an essential middle person role to try and reduce, or at least not exacerbate, the governance and red tape that
that's absolutely
facing.
Right. Absolutely right.
Is there anything else you'd like to add?
Other than to say, I really enjoyed the day, and I just want to thank you and the Croakey team for the fantastic work that you've done today. It was a gala event, probably 70 to 80 people, which was just astonishing. And I think for myself and our team at the PHN, it was really insightful, very pleasing, and really demonstrated a depth of relationship and a depth of conversation that we need to have ongoing.
Well, thank you, because I think this is a very reciprocal, sort of multifaceted arrangement at Croakey Go, and one of my reflections is how much we have benefited from your you sharing your relationships with the organisations that you're involved with and service providers. So thank you for that.
Thank you.
Mari, would you like to add anything at this point?
No, but I did think you made a comment earlier about it being a pretty brave thing.
Yes, it is, and hats off, Chris and your team at the Northwestern Melbourne PHN, because health services don't traditionally invite journalists in to cause chaos and ask lots of questions, and we think it reveals a definite mindset and culture. So we appreciate that. Thank you very much.
Thank you so much.